Let's talk about this amazing herb called ashwagandha. I want to talk about the dosage, when to take it, when not to take it. There's certain precautions, but also some benefits that you probably have never heard before. This is an amazing herb. Ashwagandha comes from the derivation of a Hindi name, ashgan, which refers to horse's odor, as in horse's urine. Apparently, this herb does have a scent of horse's urine. But that being said, this herb is quite magical in what it does. So let's dive right in. As far as the amounts that are recommended, based on randomized controlled trials, you'd want to consume between 250 milligrams to 500 milligrams twice per day. If you're doing a tincture, like a 1:5 ratio, it's recommended that you take between 2 and 4 milliliters. That's roughly between 40 and 80 drops 3 times a day. Now, personally, I don't like the drops in alcohol because I just don't like alcohol. So I like the capsules, but a lot of people like the tinctures, and it seems to work just fine. Now, the most profound effect that this herb has on people is if you feel nervous, this is the best herb to take. Ashwagandha is an adaptogen. Okay, now what is an adaptogen? A safe substance that helps you adapt to stress states. Adaptogens help you resist stress, tolerate and cope with stress better, and also help bring the body back to a normal state. Apparently, it's really good for any problems related to the autonomic nervous system, because the sympathetic nervous system is the system that adapts the body to stress. And then the parasympathetic, which is the other branch of the autonomic nervous system, helps recover the person from going through stress. So apparently this herb helps both parts of that puzzle. And since we're talking about stress, there's 2 main mechanisms that the body uses to deal with stress. One is through the hypothalamus pituitary adrenal axis, okay? And that mainly has to do with the hormone aspects of stress, specifically cortisol, which is released by the outer part of the adrenal glands called the cortex. Whereas the other mechanism, which is also controlled by the hypothalamus, okay, has mainly to do with the inner part of the adrenal gland called the medulla, and specifically adrenaline, okay? So we have cortisol and adrenaline. Adrenaline is a neurotransmitter. Cortisol is a hormone. Both of these systems are involved with stress, and ashwagandha can help both mechanisms. So ashwagandha has been known to significantly lower cortisol, which is very cool, which is going to then help you potentially lose weight as well and improve insulin resistance, because too much cortisol can cause insulin resistance, and that can create all sorts of problems, from a metabolic syndrome issue, which affects your lipids, to blood sugar, to fatty liver, to being a pre-diabetic. And also cortisol is involved with stress-induced insomnia. Not to mention adrenaline is also involved. So this herb can help you sleep better, especially if the cause of that sleep problem occurred from stress. And because the lowering of cortisol is occurring, you're going to feel calmer. You're going to have less anxiety. You'll have better brain function, less brain fog, and overall better cognitive function. Ashwagandha has been known to improve stamina, which is endurance, strength while exercising. It's a good anti-inflammatory. It's also been known to help stimulate the thyroid. So it's really good for hypothyroid type situations, but not necessarily if you have a hyperthyroid, which we'll get to in a bit. And because ashwagandha helps regulate cortisol, it's going to help your immune system. Anything related to dysregulation with cortisol is going to affect your immune system. Ashwagandha has also been known to improve male hormones, specifically testosterone, which can improve sex drive, also sperm count, as well as sperm mobility. So it's involved with improving male fertility. Ashwagandha is also good for pain, helping people with low back pain, improving spasm, muscle spasm, and it's good for fluid retention. Now, at the cellular level, ashwagandha can help increase something called heat shock proteins, which is involved in the hormetic effect, which basically has to do with getting the benefits from a moderate intermittent stress, causing the body to adapt and become stronger. So those are some really cool effects that can occur when you take ashwagandha. Now, when wouldn't you want to take ashwagandha? If you have a sensitivity to the nightshades, okay, you probably don't want to take it. Ashwagandha is high in iron. So if you have a genetic problem where you accumulate iron and you can't get rid of it easily, ashwagandha is not good for you. Ashwagandha is good if someone is iron deficient because it's loaded with iron, but you don't want to take it if you have too much iron. And like I mentioned before, ashwagandha is good for hypothyroid situations, but not a hyperthyroid situation. And so if your thyroid gland is working too much, as in you have what's Graves' disease, don't take ashwagandha.
Ashwagandha also enhances the effect of barbiturates.
And the thyroid hormone. So if you're taking those two medications, you might not want to take ashwagandha. Now, as far as pregnancy goes, there's some interesting data on this. It's been used in India for a long time, even with women that are pregnant. It's been used like as a tonic, and sometimes they put it in milk.
However, there are no safety studies that look at pregnant women taking this herb.
There's some animal studies that shows that taking large amounts does not have a bad effect, but there is no studies with humans.
Now, because of the censoring and the suppressing of the algorithms on YouTube, it's becoming more difficult to find my content. And there's a lot of content that I cannot put on YouTube, unfortunately. So to make sure you have full access of all my information, go to drberg.com and subscribe to my newsletter by clicking the link down below in the description. I will see you on the other side. I want to show you how to dramatically reduce your cortisol stress with ashwagandha. Now, what is ashwagandha? It's an herb that's been used for 6,000 years. And so it's been around a long time and has stood this test of time with minimal side effects, which I want to get into some of the side effects that are on social media related to it. I will get to that, but I want to just tell you the benefits first. It is hands down one of the best adaptogens or herbs that help you cope with stress as well as depression. It has been shown to increase stamina, especially with endurance when you're exercising. There's been a study with favorable results. The hormone cortisol, the stress hormone, which is reduced with ashwagandha, is probably the reason why it's helping shrink fibroids because it lowers cortisol. Ashwagandha also has anti-inflammatory properties. Now, here's the question. Cortisol is typically an anti-inflammatory hormone. So if we're reducing this anti-inflammatory hormone, why would you have more benefit from ashwagandha as an anti-inflammatory? You would think a person with high cortisol would not have inflammation because all that high cortisol is an anti-inflammatory. But the confusion lies in the difference between acute stress and chronic stress because when you're chronically stressed, you have this high elevated amount of cortisol, very similar to when you have high levels of insulin. You develop cortisol resistance, just like you would with insulin resistance. And cortisol resistance is a situation where you have high levels of cortisol, but the cortisol is not activated, penetrated into the cell. So we don't really get the benefits of cortisol. We get the opposite sometimes. And so with a lack of cortisol, you'll tend to have more inflammation. So probably what ashwagandha is doing is making cortisol more sensitive. And so now the feedback loop can connect and the body doesn't have to produce so much more cortisol anymore. It can be lowered. This is why ashwagandha is also good for the immune system and cognitive benefits to improve situations like Alzheimer's, Parkinson's, things like that. And there's also some benefits that it can help lower blood sugars. Now, why would it do that? Because stress activates the release of more sugar. Anytime you're in stress mode, the body will start burning more sugar. Okay, so just realize even though your diet is sugar free, you're actually living on sugar when you're going through chronic stress. So, in one study that showed significant decreases in cortisol, which is a comparison between 27.9% decrease and 7.9 decrease in cortisol with the placebo control group. And so, this is based on a randomized double-blinded placebo control study, which I'll put a link down below. So they showed significant decrease in cortisol with minimal side effects. Now you have to realize that any natural thing out there that works is going to be attacked by probably big pharma. And so you'll see that ashwagandha is having more and more side effects. People are feeling dizzy or lightheadedness or too mellow, like emotionless, right? And so we better beware because these natural remedies are not FDA approved. Like that really means anything to me. First of all, the committees that approve these drugs have a lot of conflict of interest. And secondly, I mean, just watch a commercial, right? With the massive amount of side effects that occur with medication. And they'll tell you, may cause death, vomiting, yet people keep taking them, but they're FDA approved. Do you know how many medications that are taken off the market after they were FDA approved? And then we're going to be hesitant about taking some natural thing that has minimum side effects? I mean, I just want to tell you a quick story. A lady reached out to me. She wanted some help. She had a lot of problems after her gallbladder was removed. And they put her on, I think, starting out with 17 different drugs. Okay. I think she's down to 14 drugs right now, but she's in her 40s, 14 different medications. And she wants help because she keeps experiencing problems with loss of memory and digestive problems. And so they keep sending her to another specialist, going round and round and round. And I looked up what these medications are, and then I cross referenced them to all the side effects that they create. And many of those side effects produce symptoms that she's on medication to try to relieve. I can get in trouble if I tell people to come off medication. But I basically told her that she needs to have a serious talk with her doctor and show the doctor all the interactions and all the side effects. And does she really need these medications? How the heck could anyone ever create health when they take poisons? I'm sorry, medications. I mean, I really think she needs to do a reset, and see what causes what, and only take those medications that are absolutely necessary. But I will say, all those medications are FDA approved. So, anyway, I got sidetracked. Let's talk about the dosage of ashwagandha. If you're doing strengthening type exercises or endurance type exercises, I would recommend taking roughly about 300 milligrams twice a day, in the morning and before you go to bed. And also, you might want to take it for a period of time and then come off of it for a while and just see how you feel, because it's for stress and it's very powerful. And maybe you might not need it once you really change your lifestyle and get rid of some of the stress. But the point is, you want to use these things as tools, take them as needed. They're not meant to be on for the rest of your life. But if you don't exercise, you're a bit sedentary. You probably only need like 100 milligrams once a day. So if you wanted something that could potentially dramatically lower your cortisol levels, definitely look at this ashwagandha herb. It's been around for a long time. Also, since we're on the topic of stress, if you have not seen this video on stress, which shows you a manual technique to get rid of stress, you really need to check that out. I put it up right here.